So, how old were you when you got the disease?
Okay. So I was perfectly healthy my whole life. But I had like some, little things along the way that we look back now and know that they were lupus. Like when I was in high school, I kept having knee problems, and I'd have swelling and fluid and stuff like that in my knees, and then I'd get an MRI and they'd see that there'd be swelling and inflammation, but they never could figure out like why, or any sign of injury. And like I always had a lot of fatigue. I always had like a butterfly shaped red mark on my face often growing up, that we always thought was like sunburn, or I'd have all these like rosacea creams and like nothing would ever work. And then when I was in college, I graduated in 2009, and I went to play softball in Venezuela, and I caught a bacterial parasite. And when I got the bacterial parasite, it put my body under so much stress that it like triggered it, my doctor said. So I ended up getting, the first symptoms that I had were severe joint pain. And then after a couple days, I started noticing like visible swelling. So like the first day I woke up, or it was at night actually, and my like right knee started hurting, and then my whole left leg, and then like the next day I could barely open up my mouth, and I had to like pry my teeth open with a butter knife to just like fit a toothbrush in there, because my whole joint on my jaw locked up and was like really swollen. And then like the next day, like this whole side of my head was like swollen back here. And then I just kept like every day, like something different was swollen. My feet, my ankles, my hands, my fingers, my elbows. I could barely like lift my arms up. These joints were like really painful. And then I went to the doctor, and they initially tested me for Lyme, and they thought it was maybe Lyme disease. And then they put me on like really high doses of prednisone, and I got on a waiting list to get into a rheumatologist, and they found out that I had a positive anti-nuclear antibody test, which is like an indicator for lupus, but it's also an indicator for like a ton of other autoimmune diseases. So they didn't know if it was exactly that. And then I started having a lot of GI problems, and I ended up getting diagnosed with Crohn's disease and rheumatoid arthritis for 2 years. And I was on like 20-something medications. And then I just kept getting worse and worse. Like nothing was getting better. I kept getting more and more swollen, more and more pain, more rashes. Like I was getting rashes all over my body. And then I started getting, what happened after that? I was getting monthly blood work, and they found in one of my blood labs that in my urine there was a lot of blood and protein. So that's an indicator of that your kidneys aren't functioning properly.
Right.
So then in 2011, I had a kidney biopsy, and then like shortly after that I had to have kidney surgery, where they had to manually extract all of the gunk out of my kidneys because my filters don't work properly. So for the last like 6.5 years, I've been on a drug called Cellcept, which is a anti-rejection medication that you get after you have a transplant. My dad actually is on it after his transplant. And it even though I haven't had a transplant, it helps your body accept your kidneys the way that like it does a transplant. So I was on the maximum dose of that, which I had to take 6 of those pills a day for like 4 years or so. I'm still on it, but I'm down to 2 a day.
That's good.
So my kidney function has improved a lot, but unfortunately in 2011 that's when I found out I officially had lupus, because I had kidney disease, permanent damage to my kidneys. There's a lot of inflammation in my kidneys, and then the filters don't work properly. So those were all things that ended up causing me to find out that I definitely had lupus, because when they did the biopsy, there was like specific lupus cells and specific damage that's caused by lupus. And so then I found out that I had systemic lupus erythematosus, and that's that's the type of it's also called lupus nephritis, which is like the type of lupus that attacks your kidneys. So that was basically how I found out I definitely had lupus, and it's just been really like up and down over the years. So at that point they were like, oh, we got to get you off these meds, put you on this, take you off that, put you on that. So they had switched up my meds a little bit, knowing that, well, it's not Crohn's and RA. Well, I do have like the rheumatoid stuff, but it's pretty much caused by the lupus.
Yep.
So so I switched over to different medications, and nothing really was working. So I did like a chemo treatments for a year and a half, and they worked for a little bit, relieving some of the symptoms, but then after a while I just kind of got like immune to it, and it stopped working. So in 2013, I think 2013, late 2013, in July, I started a treatment called Benlysta, which is the first ever lupus specific treatment that it basically, how it works is there's cells that are injected into your body through IV. So I sit there for like 5 hours and get this IV, and those cells are more attractive to, with basically what happens with lupus is your immune system is always working. So even when it's not supposed to be killing stuff, it is. So like its purpose is to kill like bacteria, viruses, like all that. But when you have lupus, it's just killing stuff all the time. Like no matter what's in its way, it's just killing them. So this lupus specific drug Benlysta is basically like the cells that are in the medicine are pretty much like more attractive to the antibodies than your good cells. So every one cell that it latches onto, that's like one less of your cells that it destroys.
Right.
So that helped me a lot. And for about 6 to 8 months, I didn't notice any improvement. I was on like a quadruple dose of it. I'm taking it experimentally because it's not recommended for people with kidney disease. So I'm taking it totally experimentally. And I haven't had a treatment since November because I've had repeated urinary tract and kidney infections. Oh, wow. So when you have so I've been on antibiotics since December straight, and I just got off of them like 2 weeks ago. So I've been on antibiotics for this whole time, and so they won't give me that drug because it's considered like a chemotherapy. So my disease activity has been really active, and I've been on I've been on 40 milligrams of prednisone. Now I'm up to 50, which is like, if you look that up, you'll find there's like so many different side effects and stuff. But yeah, I mean, it's been very active lately. I've been having a lot of like joint pain and swelling and stuff at night, especially. But overall, I've had a couple seizures a couple years ago, but those have been under control for the most part. But yeah, I mean, as you know, I try to stay like positive with it and do a lot. Like I talk to a lot of people. The Lupus Foundation gives out my phone number to people to call me and things like that.
Yep.
So I definitely stay active in that way, as like an advocate. And you know, and obviously we do like my fundraiser, and then I still participate in the lupus panel, which consists of like legislators, and it's called the LEAP committee, LEAP, and we had gotten a bill passed a couple years ago where there's like a lupus awareness day in May, in the state of Connecticut, and so like I'm still involved with all of that stuff.
Right.
But yeah.